Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter K. Today I'm going to talk about the kidney and associated diseases may or may not occur in the kidney, or just the other systemic consequences if the kidney has a problem, or the other systemic diseases, what the impact of the other systemic disease on the kidney. So let me just, if you follow my previous two videos, I talk about the kidney and associated renal disease, which means really the disease occurred in the kidney. But this is really referring to the other function of kidney, in addition to regulate the water, electrolytes, and I preserve the protein absorption, but just mention about the other function of kidney, which means the endocrine function. So let me just bring up the first emergency situation. Is there any emergency situation associated with this topic? Yes, like for example, if the renal artery stenosis, which causes the severe uncontrollable hypertension, difficult to control because of this renal angiotensin aldosterone system, I'm going to mention it later. So this uncontrollable hypertension, of course, which will cause the serious consequences, complications. For example, the blood pressure reading really high, cannot controlled, cause the stroke or heart diseases, which are required emergency visit. I have mentioned before. Are there any conditions associated with this topic that you can manage at home? Probably not. Anything associated with this cascade, renal angiotensin or aldosterone disturbance, has to be managed by the supervision of the medical professionals, even though it's not emergency, but they cannot manage at home. So let me just talk about the details, what I'm referring to. What the topic of this video really referring to the endocrine function of the kidney, in addition to the regulation of the water-iron balance. And this video really talking about the endocrine function of the kidney. So I have mentioned about the endocrine organs previously. I mentioned thyroid or pancreas, for example. This group of organs, or they have the capacity to secrete chemicals which called hormone, and this hormone can be has transported to the distant organ to as a target organ. So these are the really meaning of endocrine, and kidney also have this has this function. So that, for example, kidney produce erythropoietin, which is a hormone function as a bone marrow to produce red blood cells. So this is why there's a anemia caused by the chronic diseases, particularly chronic renal failure or chronic renal insufficiency, because loss of this hormone caused the anemia. And the other important hormone produced by the kidney is called renin. This renin is one of the hormones of the cascade. So this, what that means is renin can promote the other hormones, which are the angiotensin system. Angiotensin have a precursor, angiotensin 1, and the final product which really function in the body is angiotensin 2. And there's an enzyme called angiotensin converter enzyme, ACE. So this is the process, and the function of this angiotensin 2 is to, as name implied, angio means blood vessel, tensin means pressure. So this angiotensin 2 really to just increase blood pressure. That's all it does. And this angiotensin 2 not only to increase blood pressure, also can function as adrenal gland to produce aldosterone. Aldosterone, which can, as I mentioned before, it's regulating on the kidney to absorb sodium and to excrete the potassium. So if this cascade from renin, angiotensin, and aldosterone is activated, that which has a severe consequence, increased blood pressure and cause the electrolyte imbalance. So talking about this, then has to mention about the medication, a group of medication really one of the most important medication in treating high blood pressure, hypertension, which is called ACE inhibitor. ACE inhibitor really referring to a class of medication to inhibit this angiotensin converting enzyme, so to limit the angiotensin 2. So that's why it can have the function to decrease blood pressure. So this is the clinical significance. In terms of the details of this, how this renin produced, the kidney get when the kidney get the information or the signal that not enough perfusion. For example, in the situation of renal artery stenosis, could be genetic, could be caused by the other conditions, constriction, for example. So if that's the case, then the kidney get not enough blood perfusion. So the kidney get the signal and then start to produce renin, which means produce more. The purpose for this renin is to bring more blood perfusion to the kidney. However, did not really function that way, and that to increase blood pressure, not only to increase the blood pressure to the kidney, also the general body blood pressure elevation. So that's why causes this angiotensin to keep production, the uncontrollable hypertension, which could be very serious, associated with this severe complications and the consequences, as I mentioned. On the other hand, if this angiotensin keep secretion, and then the aldosterone function as an adrenal gland. I think I'm going to talk later. Details I have talked before, but adrenal gland has the cortex and a medulla, and at the cortex there are different cells separated into zones. So this aldosterone was produced by the outer layer of the cortex on the adrenal gland to increase the sodium, preserve sodium, which also causes the water driven by the sodium to increase blood volume. On the other hand, indirectly increase the blood pressure. So when the renin, angiotensin, aldosterone system is turned on, that's really the consequence is in multiple way to regulate, to increase blood pressure. So that's why the ACE inhibitor is so widely prescribed. One of the most effective medication currently circulating the market for blood pressure control. So this is about the, in addition to this, kidney also involved in the vitamin D synthesis. Vitamin D, as I mentioned before, I think it's a very important hormone to regulate calcium, to promote absorption of the calcium in the digestive system. So kidney, if kidney disease is for long-term chronic kidney disease, also have the impact of the bone vitamin D production and the calcium absorption. So this is about the other function in addition to the electrolyte balance and also water absorption, the blood volume maintenance through by the kidney. So which is really the endocrine function of this kidney as a non-endocrine system organ. But this is kind of complicated. I think what I mean is really kidney, in addition to regulate the electrolytes, water balance, and also have endocrine function. So this, I touch basis of this concept. Just if you're interested, you can search. Definitely can find more broad or deeper information on this topic. So I'm going to stop here, and thank you for watching, and I will see you next time.